Hey guys, this is Pharmacist Curtis Alexander. In this video, I'll be going over the side effects that you can see with Sumatriptan. Sumatriptan, also goes by the brand name Imitrex. So Sumatriptan is a rescue medication used to treat migraine attacks. Not prevent them, but used to treat them right away. And it's been around for quite a while, and it's it's a pretty popular medication, but it does come with some side effects. So what we need to remember is that, let's look at the mechanism of action. I do this a lot in the videos we talk about side effects. It helps you understand why side effects occur, what side effects might occur when you understand what it's doing in your body. So the first thing, Sumatriptan is a serotonin agonist. That means it basically increases the effects of serotonin, and when that happens in the intracranial brain area, you can get blood vessels constricting. We get vasoconstriction. Okay. The other thing that we see is we can see a decreased inflammation in the nervous system. Now, obviously, this can be beneficial for migraine attacks, but again, it comes with some trade-offs. Now, with Imitrex, I kind of broke it into two main groups of side effects. One is much more rare but can be serious, and then there's less rare but not as serious either. So what we have first of all is with the heart, you want to be careful. What it can do is when you get an EKG, you have that, how they measure your heart. Well, it can elongate this interval, so you get a prolonged QTC interval. It's a fancy way of saying it can screw up your heartbeat. Again, not common, but it's something that can happen. The other thing we see, remember, we're causing vasoconstriction, so there are concerns for strokes and so forth. So that's something we want to keep an eye out for. This is going to sound crazy, but we have seen temporary and even permanent vision loss with Sumatriptan. Again, let me stress, very rare, but it has been reported. And finally, serotonin syndrome. Okay, now serotonin syndrome is something you're going to hear a fair amount about when you look at any medication that affects serotonin. But in this particular case, it's more of a theory. We don't have a lot of case studies of it happening because Imitrex actually hits different serotonin receptors than what you would expect to see causing serotonin syndrome. Should you be worried about it? I mention it because animal studies have shown that it's a possibility. I've never seen it in people. I haven't seen any studies showing that it's a huge risk in people, but it is something to be aware of if you're taking other drugs that increase serotonin. Just something to keep an eye on, watch out for the signs and symptoms of that, okay? So now less serious but more common. First of all, we have pain or a sensation of pressure, probably related to the vasoconstriction. We see that 8% of folks. Then we have paresthesia, which is the feeling of that pins and needle feeling. Not common, but 3 to 5%. And then finally, hot and cold flashes. And these are sort of different side effects, but they all occur around the 3% mark. So hot and cold flashes, fatigue and malaise can kind of be combined, and then that jaw pressure and tightness, a little bit related to the sensation of pressure. So you can see that when you're looking at the triptans, when you're looking at Sumatriptan or Imitrex, one of the big things we try to avoid using is anybody with heart conditions, hemiplegic migraines. But outside of those groups where we avoid its use, it's pretty well tolerated. It does have some side effects. It has some things that you have to be careful of. But for a lot of people, it works very well when they're treating, when they're trying to abort a migraine, when they're trying to treat a migraine attack quickly. Okay, so it is a good medication. It just comes with some risks that you need to be aware of. If you've taken Sumatriptan, post it in the comments. If you know anybody who has, it's very helpful for the other people who watch the video. It's helpful for me to get that feedback. I enjoy reading people's comments, different experiences with the medication. So post those down below, and I hope the video was helpful. And until the next one, thank you.